Have you been told that you need surgery to fix your herniated disc? People like you are told this every single day, but it is a big fat lie because research actually shows that most disc herniations will heal naturally if you follow the right process. In fact, the worse your disc herniation or the bigger your disc herniation appears on your MRI, the better the chance that you can solve it without pills, without shots, without surgery. Now that might sound crazy, but in this video, I'm going to share with you the 4-step method that I teach to people all around the world dealing with disc herniation, sciatica, things like that, so that they can heal their problem naturally. All right, so here you have it, a 30,000 foot big picture view of the 4-step pain relief process. We're going to walk through each step one by one so you know why we do each step and then also the order I recommend that you do them in. For example, most people will be tempted to jump right to the exercise portion. Really fun and exciting, but even the best exercise used as medicine will not work in the presence of an environment which is not conducive to you healing. So chances are you're doing something that's picking the scab and keeping yourself from getting better. That's why I put this step before step 4. All right, so resist any urge to jump forward, and let's dive into each step in depth. All right, so the first step is that we want to translate your disc diagnosis or your medical diagnosis, which is found on an MRI, into a movement diagnosis, something you can better see, feel, and understand. And when we move to step 2, it'll be even more important because this is something that's trackable. So let's be honest. I mean, looking at this and trying to interpret the findings of this can be super scary. So rather than trying to treat your picture, I want to help you treat yourself as a person by helping you identify what I call your yucky motions, motions that reproduce your pain, numbness, and tingling. And this becomes your movement diagnosis. Instead of focusing on pushing the jelly back in the donut, we simply focus on fixing the motion which is painful or problematic. Now, here are the top 3 yuckiest motions or most common yucky motions for people with disc issues. What I would recommend that you do is you go through each of these motions just one rep one time, and all I care about is that you record or write down the yuckiest of the motions. Multiple may be painful or problematic. Just record the yuckiest. All right, so let's start with the back bend. Back bend center, starting with your feet about shoulder width apart, hands in your hips. Go ahead and bend straight backwards. See how that feels. Is it yucky or is it not? Again, just one rep is fine. Then I want you to do what we call a rotation extension or a twist to the right and a back bend to the right. So what you're going to do, sort of a 2-part movement test here, is you're going to twist your trunk to the right. Once you've done that, bend straight backwards. And again, is it yucky or not? Now go ahead and do the same thing to the left. Twist your trunk to the left and bend straight backwards. Is it yucky or is it not? Now we've got leg raises. So this is a very good screening test to determine if you have sciatic nerve irritation or sciatica. All right, so you're going to start with your heel on the ground, and then go ahead and just raise that leg, keeping it straight as high as you comfortably can. On the left side, just one rep again is good. And by the way, if this is going to be painful or problematic, you'll know it, and you'll know it very quickly. And then go ahead and do the same thing on the right side. Is it yucky or is it not? And the third most common yucky motion or painful motion for people who have disc issues is the figure 4. So go ahead and try to get the right ankle up on the left knee in a figure 4 position. See how that feels? And then do it on the left side. And again, you may have multiple of these motions which are painful or problematic. Just record and write down the most painful or yucky motion. That becomes, again, the focus moving forward. That is the thing that we fix. We're no longer trying to fix a disc problem. We're trying to fix this yucky motion because that yucky motion will prevent you from living life. That becomes your movement diagnosis. All right, so now we've completed step 1. We've decoded or translated your medical diagnosis, your disc diagnosis, into a movement diagnosis. Step 2, track. You can't manage what you don't measure. So unless you want to go and get repeat MRIs every single week to see if this thing is shrinking or growing, why not do something, again, that is more accessible? We take that yucky motion, we can assign a score to it, and then every week, on the same day, for example, we can track to see if that yucky motion is improving or not. And if it's getting better, we're on the right track. If it's not, we need to change something. If it's getting worse, well, then we've definitely got to change course. All right, so take that yucky motion from here in step 1. Remember I said pick 1. And now I want you to ask yourself, how yucky is it? Is it low yucky? Not that bad. The higher the number, the worse the pain or problem. Is it medium yucky or is it high yucky? And if it's low, is it a 10, 20, 30? If it's medium, is it 40, 50, or 60? And if it's high, is it 70, 80, or 90? And you're just going to write this down. You can write it on a notepad. You can put it on your computer. You can put it on a napkin. It doesn't matter. Just score and record it because this is what you'll go back to weekly to see if what you're doing is working or not working. Okay, so you're going to record your top yucky motion. Again, what that yucky motion is from step 1 and how yucky it is. Give it a score. And then you're also going to record what I call your biggest or your top pain trigger. So we're talking activities or positions that are most painful or problematic. For example, people with disc issues often have trouble sleeping as a pain trigger. That's something that aggravates their symptoms. Sitting is another one. Driving, lifting, bending, twisting, sometimes even walking. So put any of those activities down and then rate. Overall, big picture, don't get too caught up on it. Is it a low problem, a low pain trigger? Is it medium? Is it high? If you can only sit for 5 minutes before your symptoms start to rage in your leg, well then that's probably pretty high. Sitting is pretty darn yucky, and you would score that thing accordingly. Okay, so your top yucky motion, customize this, and then your top pain trigger. Take those two things, put it on the notepad, put it on the computer, put it on a sticky tab, and then week to week moving forward, we go back to those things to tell if what we're doing is working or not. So, can't manage what you don't measure. You've got to have a baseline so you know where you're going from there. Step 1, complete. Step 2, complete. Step 3, optimize your healing environment. Again, you can do all the best exercise in the world, but if there's something in your environment that's picking the scab physically, habit, routine, something like that, or even mentally, fear, worry, concern, anxiety, belief system, then this will keep you from getting better. So there's kind of two parts to this. First thing that I would recommend is that you do what I call calm muddy waters. So a wise man once said, Alan Watts, the best way to calm muddy waters is to leave it alone. Now that might be completely contradictory to that which you feel you want to do. Just tell me the stretch, Charlie. I believe that if I do more stretches, I'll get better faster. I've actually found, as somebody who's treated thousands of people with these disc problems, that the more you do, the more confused you are and the more frustrated you become. And the more you tick things off. So calm muddy waters. I would say for the next 4 days, cut out everything. Now that doesn't mean cut out life. It doesn't mean don't function and lay on the couch. It means cut out everything you're trying to do to fix the problem. If you're poking the angry bear, I call it, by trying massage, deep tissue, sitting on a tennis ball, foam rolling, nerve glides, pigeon poses, hip openers, figure fours, press ups, all that stuff, cut it out. You'll be all right. And by doing this, you can start to get more clarity. If you're gonna run a scientific experiment and we wanna know what's gonna work and we wanna be able to separate the signal from the noise, what's important from what's not important, we wanna minimize the amount of inputs, not do more. So calm muddy waters. Cut these additional things that you're doing in life with the intent of trying to solve the problem out so that you can get more clarity from the start for the next 4 days. And then come back and let me know in the comments what happens. You'd be surprised. Now, on top of that, sometimes you just don't know what you don't know. And that's where this part of the process comes in. And I call this morphing motions. And I think it'll make a lot of sense in a moment. So you went through step 1. You identified what your yucky motion was, your yuckiest motion was. Rather than thinking of all the motions that are yucky, let's just start with the yuckiest. You already scored and recorded that in step 2. Now I want you to ask yourself, how are these painful motions showing up in your life? Or it really should say, how is this painful motion showing up in your life? So what you want to do is you want to morph painful motions into life to help identify things you don't know yet that aggravate your pain and are keeping you from healing. Then you want to stop and modify these positions or activities. So if you can stop them, great. But maybe you have to stand throughout the day for work, or maybe you have to sit to drive. Well, then we would want to tweak them or change them or temporarily modify them, not for forever, but so that we can stop picking the scab and we can become our own best anti-inflammatory, not constantly ticking things off. All right, so what you're going to do is you're going to take your yuckiest motion. So if you have any of the back bend motions that were yucky, we're going to follow here. And we're going to say, how is that back bend showing up in life? Well, here are some ways. If you had a leg raise motion was yucky, here's all the ways a leg raise shows up. If you had a figure 4 was yucky, here's all the ways a figure 4 shows up in ways you don't know, such that you're maybe doing these things habitually and they're keeping you from getting better. This is really important. So let's start with back bend. Let's just say you had a yucky back bend, center or rotation, left, right, something like that. Well, this is how back bend shows up. So maybe you've been told to do press-ups because that is the best exercise for a disc problem, right? Well, if your back bend's yucky, then press-ups are just putting you more into a yucky motion. And the more yuckiness you put into the system, the yuckier you feel. So don't do that. Laying on your belly. Maybe you have a soft mattress and you lay on your belly and your back goes into a sway. Maybe you work on your belly propped up like this because that's what you've been told to do. But maybe it's keeping you from getting better. It's putting you into a yucky back bend and you're not aware of it. Walking. If you have a yucky back bend, then walking and standing in most cases will be painful. Because as you can see here, as I kick that leg back, it puts me in a little bit of a low back arch. Maybe standing is a problem. Maybe you have a little bit of a sway back. Again, it's moving you closer towards a back bend. So if that's a problem, you could tuck the pelvis and tilt backwards to take some of that sway out. Maybe you've been told that, hey, you have a disc problem, you need to improve your posture and you need to sit up tall. But that is putting your back more into an arch, a back bend in disguise. Okay, so take your yucky motion, morph it into motions that may show up in your life. And it essentially answers the question of how is this yucky motion showing up in ways I don't know yet. All right, so there you go, back bend. Now maybe you've got a yucky leg raise. Well, maybe you've been told, hey, I need to strengthen my hamstrings, and so I'll do this. Maybe you've been told this is the best way to pick things up. That is a leg raise. Maybe you've been told to do nerve glides, nerve flossing. That is a leg raise. Maybe you've been told to stretch your hamstrings because tight hamstrings cause back pain, right? Well, maybe for some people, maybe not for you. And so the value of going through this process is to discover what's going to work for you, not what's going to work for other people. Again, nerve flossing, slump sliders, stuff like that. All leg raises. Maybe then you go to physical therapy, or you see the chiropractor or something like that, and they stretch out your hamstrings. Again, a leg raise, just somebody now pushing you into a yucky motion versus you doing it to yourself. All the same thing, called different things, but all the same stuff. Yoga is good, right? That is a leg raise. Also shows up when you sleep. If you sleep and your leg falls across your body, that is a leg raise. If you sit on the couch at night, kick your feet up after a long day, or if you're driving, all these things are leg raises. Also, want to know why you can't run or move too quickly? Because as you stretch your leg out, puts more tension on the nervous system. That is a yucky leg raise. Same thing with bending like this, leg raise. So again, it's not that any of these things are inherently good or bad in and of themselves, but if you have a yucky leg raise, and this is something you're going to need to stop. If it's a treatment, for example, you're actively doing, trying to resolve your pain, I would recommend you stop that. And or modify or tweak. Change how you're sitting on the couch at night. Move your seat closer so you have more knee bend, less of a leg raise. Things like this. First step is awareness, and that's the intent of this step. Maybe you have a yucky figure four. That shows up in all kinds of ways. Again, in ways maybe you're paying for. Somebody's stretching you into a figure four. You doing your own stretches, your pigeon poses, your child's pose. Again, moves you closer to that figure four position. So it shows up in treatment. It shows up in the way that you sit on your couch at night, or you sit at work, or maybe this is just the way that you prefer to sit throughout the day. It shows up as you move closer and you are leaned into what you're doing. So maybe you don't cross your legs, but maybe you lean in as you're working. And you start to reduce what I call the hip trunk angle. And it very commonly shows up when you sleep. So lots of people, including myself, cross their legs when they sleep, or you get in funky positions where the leg falls across. And these are all figure four positions in disguise. This is me right here. And everyone says, well, put your pillows between your knees. But if you put your pillows between the knees, look what happens. Puts you into that figure four rotated position. Look, she's got that cross-legged position. Versus if you tweak that or modify that and you put a pillow between your knees and your ankles, then it's going to keep everything apart, and it'll prevent the figure four position from showing up as you sleep. It also sort of shows up as you stand. Some people stand like this as they're working. Other people like to hang out on their hips and push their hip or shift their weight to one side or the other. Try standing with your feet much wider apart. You'll notice you're much less likely to shift weight. So again, just some ways. There are other ways, but this helps you to start to do the detective work to figure out, man, how am I picking the scab in ways I don't know yet? And now you know. All right, so that's morphing motions. Step 1, step 2, step 3. Now you're mostly optimized for healing. Now we can talk about this idea of using movement as medicine. I don't know about you, but my goal is to never take more medicine than needed, but it's to take as little as necessary to achieve the desired result. In this case, to resolve your disc problem, your pain. And so if you consider that movement could be seen as or used as medicine, then why would you do a whole sheet of exercises? You wouldn't. You would want to find the one thing. Because if you do a whole sheet of exercise, it's possible that exercise number 5 is counteracting exercise number 1. Or maybe exercise number 2 has a side effect that exercise number 7 can't undo. I think you get the idea. We want to be scientific. We're tracking things. You can't manage what you don't measure. But then if we're doing a bunch of random things, we'll never know the results or the outcome of those things. So these are 3 common exercises that I might prescribe to someone who has a disc problem. Now, how do you know if they're right for you? This is the process. And by the way, it's okay if you don't respond to any of these. There are many different options that we could potentially test. Right, so just to give you an idea, a seated forward bend. But Charlie, I was told that this is the worst thing I could do for a disc problem. Well, that's interesting, because if you bend backwards and it hurts, what's the opposite of hurts? Doesn't hurt. What's the opposite of backwards? Forwards. Is it possible that which you've been led to believe will solve your problem, bending backwards, all those press-ups, which you've been told will push the jelly back in the donut, are actually making you worse? Why not bend forward? Do the opposite to get the opposite result. So a seated forward bend. Again, it won't work for everybody, but here's how you tell if it's right for you. You first test, then you treat, then you retest, and then you follow some logic. So to test, we need to do 1 rep of your yucky motion. Maybe it's a back bend, so do 1 rep of the back bend. How bad is it? It's a 50, it's a 60, it's a 20, it's a 30. Get an idea, take a snapshot just one time. Then I want you to try right now a seated forward bend, hands on the floor, hands on a yoga block if you can't get to the floor, hands on your knees if you want more support. Do a seated forward bend, 3 30-second holds. Do a 30-second hold, come back up for a moment or 2, then go back down 3 times. And then you're going to retest your yucky motion. Maybe that's a back bend, maybe it's a leg raise on your right, maybe it's a leg raise on your left. Maybe it's a figure 4 on your right. It doesn't matter. Pick your yuckiest motion, do it here to test it, get a baseline. Then treat using this input, which by the way, this should be pain-free. I'm not a fan of doing things which are painful. and then retest to see what that thing does. Does it make your yucky motion, and we're gonna follow some rules, better? If so, you're done. That is one motion that is not only safe and pain-free, but immediately improves how you feel, your yucky motion, which is how that disc problem shows up for you in life. That is your movement diagnosis, and we just fixed it. We're improving it. That's awesome. If same, well, guess what? I don't know about you, but I don't want to do something that doesn't work. And if something doesn't work now, I have no evidence to believe that it will somehow or in some way work in the future. And I suggest that you shouldn't just believe it's randomly going to work in the future either. And if it's worse, obviously we would stop that and we would move on. Now on to the next motion that benefits lots of people with disc issues is the seated trunk twist. And you have actually two exercises in one. So a lot of people are really obsessed with, if they go to the right, they also have to go to the left. They have to do exercises on both sides of the body. But that would be like saying, why don't we try turning the screwdriver to the right 5 times and then also going to the left 5 times? And well, try that out and let me know how it goes, right? And so it's possible that twisting only to the right could make you better, but going to the left will counteract that and will make you worse. And so I recommend that you segment these things out. This is one exercise, the trunk twist, but it's really 2 in 1 because you have a right and left side of your body. So let's walk through how you would test that to see if it's going to be a fit for you. So what you would do is you would test, again, you would perform your yucky motion, just 1 rep, 1 time, whatever that may be. Back bend, leg raise, figure 4. See how it feels, get a baseline. Then you would only do the right seated trunk twist 2 times 20 reps. Do not go to the left. Then you would retest that yucky motion, your yucky motion, just 1 time to see if better. If so, you're done, and we can use it as medicine. If it's the same, then, well, doesn't work now, so I don't believe it'll work in the future. We're going to move on. And if worse, obviously, we're going to move on as well. So if better, here is your movement prescription. You're going to do 2 times 20 reps, 2 times a day as needed. Now, let's just say you did the forward bends, that didn't work. You did the right trunk twist, that didn't work. Well, now you have a left trunk twist. So go ahead, perform your yucky motion again. Do the left trunk twist, 2 times 20 reps, only to the left. Retest. If better, then you're done. And you would do 2 times 20 reps to the left only. You don't need to do it to the right. 2 times a day as needed. If same, move on. If worse, we're not doing it. And the final motion, which I see helps lots of people with back, butt, sciatica, disc sciatica problems, is the figure 4 strength. So if lengthening the tissue via a figure 4 stretch doesn't work, again, what's the opposite of doesn't work, does work? What's the opposite of lengthening? To shorten or to contract. Figure 4 strength, many people call this the clamshell. So how do we tell, though, if this is right for you? It sounds good in theory, Charlie, but how will I know if it's best for me? Well, go ahead, test your yucky motion just 1 time. Perform 3 holds of this exercise until tired. And by the way, I would start with it on your painful side. I often find that is the one that makes the most difference. But don't negate the possibility of doing this on your pain-free side may actually help you out as well. So if you want, you could split the clamshell into both right and left sides as well. But go ahead, perform 3 holds until you're tired. Again, this should be pain-free. You'll feel it working, but it should be pain-free. Then after you do that, retest your yucky motion. If better, you'd be done. If it's the same, maybe try the other side to see what happens. And if worse, we're going to stop and we're going to move on. And we would have to test other motions. Let's just say it does help. Then I would recommend you do 3 holds until you're tired as the prescription twice a day as needed. All right, so that is the process. Translate, decode your medical diagnosis into a movement diagnosis so you can see, feel, and understand it and track it week to week. That's step 2. Optimize things. You can do all that you want, which you believe is going to help you, but if something in your environment is keeping you from getting better because you don't know it's picking the scab, then guess what? It won't work. So calm muddy waters for 4 days, morphing motions so you understand how these yucky motions are showing up in life and what you need to change or tweak or modify temporarily. Then we want to use movement as medicine very scientifically, very systematically to identify the one motion that is not only safe, but immediately improves your movement diagnosis, your movement pain relationship. I do this, it hurts. I do this thing, one of these pills, one of these movements as medicine, and then I see an immediate improvement in that thing which is problematic for me, your yucky motion. All right, so there you have it, the 4-step pain relief process I teach to people like you dealing with disc problems who want to learn how to heal naturally. For other pain relief tips and tricks, be sure to check out my other videos. Thanks.